The development of this special commission really came as a result of the permanent suspension of the Complex Level 2 PE, that assessment of clinical skills that's part of the comlex-usa series for licensure for osteopathic physicians. And so with that suspension, there are two things that really had to be done. One was that there had to be recommendations regarding next steps. You know, how do we work with regard to a licensure pathway that includes the assessment of clinical skills when we just can't utilize an exam that was part of that series? So some short-term recommendations with regard to clinical skills testing as part of licensure. The second real purpose really had to do with let's examine and understand and get input from a wide variety of stakeholders, everyone who's affected by the licensure process, clinical skills, and look for ways to plan for the future. You know, through hours and hours of work and testimony and input from colleges, from students, from licensure, from the public, four main themes came out. The first had to do with the need for identifying long-term solutions for assessing osteopathic clinical skills and those competencies that are part of a licensure pathway, comlex-usa. So that was number one. Number two was, in looking towards the future, how do we ensure that concepts and principles around diversity, inclusion, and equity are included? That should be throughout the entire series. So thirdly, our recommendation, the theme, really had to do with ensuring that new competencies, new content area was part of not only clinical skills, but also of the whole Complex-usa series. And then lastly, the highlight around the need for evaluating technology in the delivery of assessment needed to be examined from the perspective of not only what's possible, but what's practical and appropriate for high-stakes examinations. So it was really essential to bring folks together across this entire continuum. We had students, residents, faculty, com deans, licensure folks from the NBOME, AOA, across this whole spectrum, in one way, shape, or form, was affected. Assessment for licensure is part of this system that impacts this delivery from medical student education through the licensure of a practicing osteopathic physician. So with this suspension of a key element for the osteopathic profession, we really had to bring folks together from all these perspectives so that we would be able to bring the best information and come up with the best solutions. One of the things that I think is essential in creating and providing the best solution for a challenge is having diverse input from all those perspectives. When you do that and people do good listening, and you're most likely to have a very rich discussion, the development of ideas that you wouldn't get with just one or two people or one or two groups in the room. Not everyone may be happy, but the outcome is one where you actually get the best input for a solution related to high stakes activity and with the least amount of blind spots still left behind. The discovery through this whole process of what we assess and our focus around what DOs do in practice, what we do in education, is actually something that serves patients, and that even through the process by which we created and obtained an inventory of the types of assessments that are done at our colleges, we really discovered the greatest emphasis and focus around clinical skills. Clinical skills like communication and professionalism and the delivery of osteopathic manipulative treatment. So this discovery of what matters and to do so in a way that meets a standard, I think really serves the public, serves the learners, and serves each of us.